Hi guys, today let's talk about fear in nursing, and not necessarily fear of your patients, although every now and then you may catch a hook right to the jaw, or just this week I saw one of my colleagues get a cup thrown at her. So you really never know what is going to happen with the patients, but don't necessarily be scared of them, or at least that's not what I'm talking about today. The fear in nursing that I'm talking about today is the fear that you really kind of need to keep. Don't necessarily just be anxious and scared of everything, but there are times that you give medications that may or may not kill someone. You really need to pay attention. And the fear, what I'm talking about, is you have the fear so that you can continue to pay attention to exactly what you are doing. When you become overly confident, when you become a very confident individual, and you just don't really, you know this job, and you know how it runs, and you know the ins and outs, and you know everything there is to know, that's kind of when you start making mistakes. Now, as an individual who has had a med error in the past, yes, I have, I feel like it kind of calmed me down, slowed me down a little bit, because when it happened, it wasn't a big med error, but it still happened, and it scared the fool out of me. And then as I look back at it a little bit later, what scared me more is the fact that I wasn't scared necessarily at the time of the med error. Now, I was terrified, immediately after the med error, because I realized what I had done fairly quickly. But what really scared me is the fact that I was just kind of, lollygagging along and made a med error. And I was like, wow, I really was not paying attention at the time that had happened. And so I kind of stepped back and really began to look at everything and realize, hey, certain medications can or cannot kill someone depending on the dosage. Looking your way, insulin, that is definitely a, one that could definitely do it. You mix up fast acting and give a bunch of units of fast acting, or, maybe not enough units of long acting, or, some various combination thereof, you could definitely send somebody DKA or drop their sugars and, really do some damage. So you really got to pay attention. You've got to have that fear in you and respect the medication, respect what it is you are doing, and that is the fear that I'm talking about. You have to have that sort of fear and respect for what it is you are doing. I'm not saying go out there and just have yourself a great big old panic attack. I really don't want that to happen. That's, I don't want a terrified, panicky nurse. I don't want that to happen. But you still need to respect and fear what it is you are doing, as a lot of times you have people's lives in your hands. You have the ability to really hurt someone, or really not hurt someone. You really don't want to hurt someone. Trust me, I don't want to hurt nobody. I don't want to make no med error. So I've still got the fear inside of me of what these certain medications can do, and I respect them, and I acknowledge that these medications need to be taken serious. Not only medications, there are various treatments that can hurt people as well. You leave somebody on too long, or off too long, or whatever it may be, and those things can have an issue. Something as simple as a catheter. If you empty a catheter, or you do a straight in and out real quick, and you start getting close to that 1,000 cc's, maybe it's time to go ahead and stop, or you're going to hurt somebody, or can possibly hurt somebody. I typically stop at about 700, given the opportunity. I haven't done a catheter in a long time, though. But you got to understand that. You've got to kind of have the fear of the procedures of what you're doing, so you respect them, so that you acknowledge that there is a danger, and you acknowledge that your job should be taken serious. I just feel like I've worked with very confident nurses. I have, and when they're very confident in what they're doing, especially when they're new to a procedure or a job, that's when mistakes are made. I go to all new procedures very timid. You know, not anxious, just kind of timid, so that I kind of can figure out exactly what's going on with this procedure. So always have that little bit of fear about you, that respect. Don't ever lose that lack of respect. Keep the fear with you, and always respect what it is you do as a nurse. Always acknowledge what it is you are doing. Read the rules, the instructions, whatever you want to call it. Know what you're doing and respect what you're doing. That's what I got for you today. If you take a look over there, there is a subscribe button. Click that deal. If you look over there, there is a video that YouTube is saying you will like. Click that deal as well. Hope that helps. I thank you much.